Do resume those surgical procedures and patient treatments that were paused due to coronavirus. Well, donors are urged to give now to ensure that blood products are readily available for patients.
Joining us via Zoom this morning from the Red Cross of North Alabama is Executive Director Khris Anderson. Khris, good morning and welcome back to the show.
Good morning. Thank you for having me.
Absolutely. I want to talk about these blood products and how they're so essential to the community health, and the need really is constant year-round. Can you kind of explain the Red Cross's efforts to encourage more donors, especially now that you're offering free antibody testing?
Yes, well, the need for blood does not go down, as you know. We have surgery, non-elective surgeries. Of course, elective surgeries have begun again now, and we need that blood. Cancer patients, I'm a survivor, and I've had blood products from, to help me actually survive. Burn victims, blood disorders, the list goes on, and people that needed blood before the pandemic are going to continue to need blood after the pandemic. And we are excited to be able to offer antibody testing now.
Well, and so when it comes to the community needs altogether, Khris, which area or blood types seem to be the most critical when it comes to patient needs right now?
Right now, all blood is needed, all donor types. Of course, universal donors are always needed. But right now, I would say the biggest need for the Red Cross currently is to find places and groups of people willing to host blood drives. So if you have a church and you've got a large congregation, maybe your building isn't being used a lot right now, but we are looking for those places where we have groups of people sort of already together that we can come and set up a blood drive. That's really a very big need for us right now.
When you think about setting up those blood drives, though, there's still a lot of concerns out in the community thinking about gathering in those places. How do you guys kind of ensure that everyone is being safe and that it is, in fact, safe to give?
Absolutely, and a lot of work and effort has gone into that. First, you have to make an appointment. So the days of sort of dropping by and hanging out and waiting your turn to give blood, those are kind of gone for now, but you have to make an appointment. Before you're even allowed to enter, there is a screening to make sure that you have no symptoms. We, of course, do the social distance, the 6 feet apart, the beds, the waiting area, everything is done with the social distance rules. And then, of course, mask. Everyone is required to wear a mask, and then our staff are still following those incredible safety precautions that they've been doing. So it is a very different blood drive than what we've done in the past, but we're really proud of it. And the people that come out and do give blood are truly heroes.
Let's talk about the rare blood, especially those affecting those sickle cell patients out there, Khris. I mean, I know it's difficult right now. What's the need in that area?
Sickle cell anemia is the #1 blood disorder in our country, and it affects a lot of our African American population. And interestingly enough, the African American blood is the best blood that we can use to treat that because of the antibodies and the antigens that naturally occur there. So as we've seen the corona virus spread and impact our communities, the number of African American blood donors has gone down. Like, all blood donations have gone down. So we're really looking for help with that so that we can increase those numbers and help more people.
All right, and for a limited time now, the Red Cross is offering free antibody testing. I want to put that out there for those of you able to give blood. Khris Anderson, Executive Director for the Red Cross of North Alabama, thank you so much for your time this morning.
Thank you guys so much for having me.
Thanks. Great job you guys are doing, Khris. Thanks so much. 6:41 right now.